Hi everyone, and welcome to episode 65 of SAMA. SAMA is a program where we invite an expert to talk about their area of expertise. And this week we're delighted to have Lisa Dennys. Now Lisa is a certified life coach, medical intuitive, business intuitive, channeler and personal growth catalyst, who has worked in healthcare and personal transformation fields since 1977. Her personal professional careers as a doctor of Chinese medicine and acupuncture and an occupational therapist have given her a unique, holistic perspective on health and illness. Lisa is an author. She's written Unveiling Lyme Disease. Is this what's behind your chronic illness? And this is what we'll be discussing a lot about today. She describes her 30-year odyssey of chronic illness, culminating in a chronic Lyme disease and multiple co-infection diagnoses in 2015. And today she's going to share her hard-won wisdom and strategies that she has to help people find their own path to better health. Now, during this interview, we'll be talking about highlights in her own health journey and also why she wrote her book, and actually a whole lot of stuff. But I'm pretty keen to start talking right away, Lisa. So welcome to our show. I'm so happy to have you with us.
Thank you very much, John. I'm excited to be here too.
Now, I read your book, and my heart reached out to you. You went through very, very tough times. Would you be willing to talk about the early years of your life as you talked in your book, and how, because it mirrors a way a lot of people's lives, they have complications and things which weigh them down, and you've overcome your obstacles. So how did it all start? When did the troubles start?
Well, yeah, I'll get into that. And just before I start that, if I may, I want to just give a snapshot of where I'm at now, so then I can go back and
Sure.
lead back up there, because it's a bit of a misnomer. I think sometimes that, people like myself and so many millions out there in the world dealing with chronic Lyme, that you find out what it is, you treat it, and then you get better. And so there's the assumption, because I wrote the book, that I'm better now, and I'm actually not. So where I'm at right now is in the recovery journey. It's a very long process for all of us, who are dealing with this. And so I'm still dealing with a lot of symptoms, very typical symptoms that other people deal with as well. Some a bit worse than others, and some not nearly so bad as people suffering with this. So I still have a lot of neurological issues with brain fog and pain and dizziness and rounds of vertigo, all body systems affected, from digestive to gynecological to hormones to muscular, typical again with Lyme and co-infections, oversensitivity to stimuli. So lots of things having to kind of work around day by day, and then ongoing multifaceted treatment, which we may or may not get into at some point today. So one of the things I did want to start off with is say, because I'm, that whole thing that, oh, well, you look fine and you must be fine, that so many people with Lyme deal with, is, no, I'm not actually, but yes, I can function for a few hours at a time. And so I'm thrilled to be here functioning for a few hours, for an hour of our time, to be able to talk about this. And I really wanted to bring kind of the human side of Lyme to this today. There's so much incredible information out there for people in my book and so many other books. And, people are thrilled to find that. But I don't see so much discussion on, what's it like in the day-to-day reality, and what are the kinds of things that people are facing all the time, that even often their loved ones, their friends, their family, co-workers, if the person's well enough to work, they just don't know about. So I'm hoping to flush some of that out a bit today through my own story. And the other reason I wanted to come up front and say, no, I'm not all better yet, it's definitely a work in progress, and pretty rough going some days, as I have all these notes in front of me today and which I may or may not use or look down on. But I wanted to just be up with that too and say, there are so many things with Lyme and so many other chronic illnesses that involve cognitive function that people have to find ways to compensate. So this is my way to compensate to incredible list making and note taking and stuff.
Sure.
So after that little preamble, I'll get to my story. So my story is about, I'll just highlight some of it, not spend too long on it, but I think it's relevant for so many people I think can identify. It's been over a 30-year journey, and the label that I started having I had a few health problems as a child, and as I look back, I can see sort of certain triggers for immune system challenges, which many of us have from early trauma to health issues to family issues to stresses, like so many people deal with. So around late 20s or so, I had my first episode, which nobody knew what it was called, but it later became a label of chronic fatigue syndrome. I was working as an occupational therapist, had to take a few months off work, stopped completely for a while, and debilitating fatigue. But I seemed with rest to bounce back and thought, okay, well, that was a one-off deal. Looking back on it, probably that was the time that I think I got a tick bite, although I didn't ever identify it at the time. I used to camp and stuff and be outside, and chances are that risk factor was there for that. And often people don't ever get a rash and don't ever identify a tick bite, don't feel anything. They just get flu-like symptoms or feel ill. So that was likely the case for me. So really over this long period of time, it was this pattern of debilitating fatigue and other symptoms, rising up, having to stop work for a period of time, dial back, get a bit better, rise up again with, everything from family deaths to life stresses, work stresses. And, this is something I think so many people will relate to. You start to think that you're losing it. Like what's wrong with me that I can't keep up? And, apparently there's not that much wrong with me. I've had this and that test. And typically people go from doctor to doctor to doctor trying to find their way. I was more so from a very young age, in my 20s, oriented to holistic medicine. So I didn't do the round of 25 specialists in orthodox medicine that so many people do looking for answers. I realized, probably fortunately for me, for aggravation, I didn't go through going to one more infectious disease doctor be told that I needed a psychiatrist. And that's what a lot of people deal with, right? So I sought a lot of supportive holistic therapies, homeopathy, naturopathy, supplements, lifestyle things increasingly. But this pattern of getting sick or getting better led me to change whole careers, retrain in things, attribute all kinds of external factors to why I kept getting sick, blame myself. So I think that a lot of the things I want to emphasize, it was my story and so many others, is this waxing and waning that can be typical of Lyme, the worsening under periods of stress, and the just not knowing, and then this terrible self-recrimination and blame. And so many of us with Lyme are very type A driven people. Good news, bad news. You can harness those things to move ahead and find answers, which I've done, lots of people have done. But the bad news is that kind of way of being in life really can set you up to drain your adrenals, tax your system, and put quite a big load on your immune system because of so many, mind-body connections. So I think that's what happened to me. This did my best, change things, went up and down, and would get better and worse.
As I was reading your book, you go into quite fine detail in personal things that happened in your life, and it gave me the ability to almost put myself in your position. I could really feel the situation rather than hear something from a technical and a medical perspective, on a personal perspective. And it was a very powerful book. It's a very powerful way of painting the image so people can fully understand what it's like to suffer from Lyme. And I don't know how you did it. You put yourself through 4 years of study for becoming a Chinese medicine.
Yeah, Yeah, I did. I loved my career as an occupational therapist, but I couldn't keep up with full-time hospital work. And I sought Chinese medicine and acupuncture as a treatment, and it was really working for me. I thought, well, this is fascinating. And who knows why I do what I do sometimes, but that does speak to my motivation is that, okay, well, while I'm lying in bed recovering, I guess I'll take on a 4-year Chinese medicine doctorate program and, study lying down, which I did, but I improved enough that by my 4th year, I could do the clinical work with patients and stuff, and then set up my own clinic, and I thought I was home free after that.
Yes.
But again, deaths, stress, close family deaths, the stress of running a busy clinic with employees and seeing clients day in and day out, and that downhill slide that I didn't realize why. I didn't know that I was dealing with Lyme.
Gosh.
Yeah.
Okay, so there came a point in time when you did find out you had Lyme. How did you find out? Where did you go?
Yeah, great question, because so many people are dealing with this, right? Is how do you figure this out? And that was one of my big motivations for writing the book. Okay, hopefully I can save anybody 30 years of this and, find some direction in terms of where to go. So I immersed myself several years before my diagnosis in the internet learning on every conceivable thing about holistic health. I attended, I think, every summit that was out there. There's lots of them. I read blog posts. I just kept searching and searching, and then I came across a blog talk radio show by Dr. Jess Armine and his colleague Sean Bean were doing out of Philadelphia, and got really fascinated by their particular approach to looking for a root cause of chronic illness. So I participated in the show, questioned them, and said, so how do you guys approach complex chronic illness when you don't know what's really going on, and how do you assess? And so I got great answers from them and pursued that line, became a client of Sean's, and then he suspected Lyme, and I was dumbfounded because I barely heard of it, like so many people. No one had considered it, and 30 years of my travels, I'd just been told, well, I wasn't managing my life properly with chronic fatigue syndrome, and I needed to reduce my stress. Thank goodness I didn't get sent to psychiatrists, because I just avoided the system, basically. But many people have just been told they're full of it and, go see a psychiatrist. So it was through that drive for self-education and the beauty of the internet, it was so much is available that I just persevered, and I said in the book, I hit gold. I found some really good people, and then Sean referred me on to a Lyme literate doctor, a physician who then I went to for a period of time and did triple antibiotics for almost a year, and realized that wasn't quite the solution either. And that was kind of where I ended up finishing the book. So now this is the rest of the story. It goes on, and that's typical.
Now, what was the effect of the antibiotics when you're taking them?
I felt fairly lousy on them, but it was unfortunate that, often you'll see a very definite Herxheimer reaction. For anybody who's not familiar with that, it's basically whatever you're taking is killing stuff off, killing off bugs, and then your body reacts to it because you can't detoxify or get rid of the debris, I guess we'll call it, fast enough. And so you end up with all kinds of pretty yucky symptoms from that. So I was feeling pretty yucky most of the time anyway, and I didn't get that clear-cut, oh, go on this, cocktail, get the Herxheimer reaction, and oh, great, get the improvement afterwards. It was very muddy for both the doctor and I to figure out. I was taking very good notes, tracking, multiple symptoms daily, but we couldn't see clear patterns. And I was still doing a bunch of holistic supports at the time, which muddies the waters too, but I wasn't going to give up on all these things, the energy work and other things that I felt were really supportive and important. So, it becomes that's one of the challenges out there in the treatment world, is trying to discern, this cause and effect with symptoms. So I still, to this day, I have mixed feelings about it. Some people manage Lyme never taking an antibiotic, using all natural approaches. Some people do only antibiotics. part of my mind is happy that I did that too, because it was one thing I hadn't tried for 30 years, is to go heavily with the drugs. But unfortunately, that wasn't the magic bullet for me.
Right. What do you think are the major challenges that people face who are living with chronic Lyme disease?
I thought about this a lot, and I'm active online a lot with people. I talk to a lot of people, message with people, and the three big areas that I see, and then I'll list some of the other ones. But one is this theme of grief and losses, past and present, in every area of living. And I'll expand on that a bit. But grief is humongous. It's a really big challenge. And the other thing that I see is a huge desperation to make the right decision for treatment. The pressure on people is tremendous. The options are almost infinite, from orthodox mainstream medicine to full gamut out there of holistic and energetic modalities, all of which have something to offer. I think I'm not sort of it's only this that matters and that doesn't. I'm very open to all these things, but people are desperate. And, some of what I hope to talk about today is, okay, how do we handle some of that desperation? What are some ways to try and, feel like you're making the right decision? The third big area of challenge I see with chronic Lyme is that the treatment process is so long. It's protracted, it goes on for years, and it's not a smooth path. It's very, very up and down, and times of, some people call it relapse, or just increased symptoms, can be absolutely devastating, because people get this little glimmer that, oh, I'm getting a piece of my life back, and then whammo, for days, weeks, months, they're back down again. So those are really challenging things. And so this confusion, the overload, the symptoms themselves are really hard. The loss of personal power and control over your life when you're so limited, goes into that grief and loss part.
Yes.
Lots of financial stress. It can be huge, because most treatments are out of pocket if people can do it. A lot of people can't even get treatment. Getting stuck in kind of survival mode physiology. We get stuck in this fight, flight, or freeze response, which is a real problem. I talk a bit more about that at length in my book. And that sets up for all kinds of challenges of making it harder to think clearly, because in a fight, flight response, the frontal cortex is shut off, and you don't have that clear thinking. So when you're operating from your survival brain, you can't make decisions very well. There's lots of stigma, associated with invisible chronic illnesses like this. I mentioned a bit about that earlier, that, oh, well, you look fine. Isolation from not being able to fulfill, our different life roles, and loss of independence. Just simple things like loss of fun and enjoyment, because every day often becomes a survival focus and a treatment focus, and then some of those things drop off and relationships drop off. Relationships change and are stressed, and some of the isolation comes from that. Dealing with health professionals is another big stress, especially ones who don't understand. So I could go on and on, but those are highlights that I see, and many more.
They say that the good thing about a bad time in your life is that's the time when you discover who your real friends are.
Yes.
And in your book, you say two friends who stuck with you and helped you in your battle. Now, one thing that struck me also in your book is you say that you kept a detailed log, so you could see the effects of anything that you're doing. And so you've mentioned us now. You'd see a little bit of an improvement in that wiped away, but you could see long-term changes, which are harder to see if you don't keep a record of this. So that struck me as a very
I think some, and people have their different preferences, and so do their caregivers have preferences. But I think keeping some kind of short notes. I still do it. I started when I was going to the Lyme doctor 3 years ago, and I think I'm on page 380 in a binder of, a little paragraph at the end of each day, how they went, highlights of, changes in treatment strategy. But really, this kind of thing needs to be documented or you lose track. And often with Lyme, I know for myself and others have said this, you can't judge like, oh, I'm better this week or I'm better this month. You have to actually look year by year. So for myself, I can go, oh, I'm doing better than I was last year because of this and this, even though day to day, often you'll lose track of that. So yeah, it's a good point that you bring up about the tracking for sure.
Now, apparently you've developed 3 skills which are necessary in order to take charge of your health and create a greater state of well-being.
Yeah, the 3 areas that I like to talk about are, the first one is being your own advocate, and I'll elaborate on that a bit. Maximizing your daily function, meaning taking control over how you do things and when you do things during the day, and that is a very underappreciated thing that you do have control over, but I think people often don't really realize what a difference that can make. And the third one is increasing your self-awareness. And these things all tie together, so I'll talk a bit about each one. Being your own advocate, I think, is kind of the key thing. It's a mindset, it's a set of actions, it involves beliefs and values, behaviors. So, but the concept, that the term that I came up with is being the general contractor of your own health. It's not what we're taught. We're taught, okay, I have something wrong, I go to the doctor, not 25 doctors, the doctor, and they will give me X thing and I will get better. Any kind of condition like this throws that completely on its heels, and it's not reality. And the sooner anybody can ditch that old paradigm that doesn't apply here, the better. Easier said than done, because it's very intimidating in a new doctor's office. People are scared about their health. I recognize how difficult it is. So that's why I call it a skill. It's not something we're not taught about this. It's a whole new mindset, and it's a new way of operating, inside of the medical system and outside of the medical system, and searching for information and standing up for yourself. So many things, hiring and firing health personnel for a healthcare team, because as Sean Bean, I mentioned earlier, said that, and Jess Armine both, that every practitioner has what they call an information wall. And I love that expression. With this, and we're not taught about that either, that a health professional can be fantastic in their area and it's this much of an area, the next one is this much, and the next one's this much. And the sooner we recognize that they're limited by being human beings and they're limited by their own information walls, the better for everybody. So I think that's a concept as part of the general contractor concept, and being your own advocate and speaking up for yourself. We have to know who we're going to, what their limitations are, what their field is, and not expect that you're going to be able to unleash all your emotional angst, well deserved, of what you're going through when you see your cardiologist, because really they're looking at your heart, and that's all you're going to get. And it's much better for everybody if we learn how to work around these things. So definitely that area, the advocacy area is huge. General contractor. The maximizing daily, is it okay if I just continue?
Oh, great, yeah.
The maximizing daily function part, this concept, this is a kind of the roots of occupational therapy, and that was my first career, is looking for anybody with an illness, accident, chronic illness, injury. We look through the lens of how is this affecting mind, body, and spirit, and within that context, daily function. So I've thought about this since I was 18 as an OT student. So it's a very ingrained pattern of thinking, and unfortunately, I made the assumption that everybody thinks this way, and I realized, oh, actually, that's not true. I think it's an area of kind of untapped potential that I see in so many people who are ill, that they don't realize that if they do things in certain ways, if they assess, how hone that observer self of being able to say, how do I go through my day? When do I get up? When do I rest? What do I eat? What do I drink? Where are my stresses coming from? What gives me joy? How do I relax? Do I sleep and rest properly? Do I really want to do this? Do I have to do this? Do I feel shoulds coming at me? All these kinds of self questions, and then slowly developing new habits and new behaviors can completely change your life. So, for an example, for myself, if I didn't have the strategies, the habits, the structure that I have in my day, I wouldn't be here doing the interview. I wouldn't have written my book. I wouldn't be seeing clients part-time. I wouldn't have the level of function that I eke out, and it's very designed. It's very, almost contrived in a way, but it's made possible by how I schedule my days. So, I think that's something really worth looking at for people, and it can be a new concept. People think, well, I don't feel well, so I just can't do anything. But when you start to really dissect this out, you can find fantastic pieces of information that then you can start to modify the way you do your day, and it can make a tremendous difference. So there are always workarounds, and in all the gloom and doom of this horrible experience of Lyme, that's, an important message that I really want to get across to people, is all is not lost, and you have more control than you think. But it's a learned skill, and that's why I call it a skill. It's not something innately that you necessarily have ever done before. You might need some help with it. So the maximizing daily function, I think, is a huge thing. One of the naturopaths I follow online, Ben Lynch in Seattle, Washington, written a book recently, a lot of great work out there. And he says that attaining good health is a 4-letter word, WORK. So I think that is brilliant, because, again, old mindsets, attitudes, we're taught that, well, I should just be able to get up and do my day, or maybe it doesn't matter what I do. And really, if you put your mind to it, get some help, design things in certain ways, you can get more out of, within the limitations, of course, of your function. And some days are better than others. Sometimes it's a write-off and you just have to go to bed. That's it. So,
Gosh.
yeah. So the building greater self-awareness, this is an area where I spend a lot of my mental energy, emotional energy. It's a strong interest area of mine in working with clients and working with myself. And I think this whole, again, in the world we live in is very action-oriented. It's very external-oriented. It's not internally oriented. We're not taught about how to be and how to connect more deeply with ourselves, and how to find that inner strength, not by kind of false bravado, but find that inner strength through self-compassion, self-acknowledgement, understanding, what's going on with ourselves, and taking the time and the will and the ability to really go inside and say, what's going on? What's driving this behavior, or what's behind these feelings, or what's driving what's going on here. So this building self-awareness, I can't emphasize enough as a strong, again, a skill, takes practice, many, many layers. I think self-awareness is a lifelong journey. And good news, bad news, when you have a chronic illness, you can fast track that because there really isn't, it's a strategy for coping. It's a strategy for surviving this experience. And it's also a strategy and a skill building for being able to see that larger picture of what this at times horrible illness opportunity is providing you in terms of how you can learn to grow as a person. That kind of concept makes people just about barf when they're sick, because when you're too sick, self-actualization or personal growth is just, somebody would just hit me bringing that up, I'm sure. But when you have, a little more mental faculties, a little bit more energy, or the inclination naturally to kind of start looking inside and go, well, who am I now, and what's going on with this illness, and what's going on with this, the awareness of the fight, flight, and freeze responses, which I talk about in the book. That's a huge self-awareness piece that, again, can be learned about, modified, bring ourselves down when the stress level gets high. And you have to be self-aware. You have to learn how to tune into your body in order to do that.
Yes. Tell me, Lisa, how have you used intuitive tools as part of your care decision-making for your health?
That's been a huge area. And as I mentioned earlier about that treatment angst that people get into, what do I do? What do I do? There's so many options. How do I know what is right? That's where I think, and choosing practitioners too, those are areas where I've used, instead of just all cognitive, which can go around in circles of pro and con list and all left brain activity, right? Fortunately, I did really strong formal intuitive training because I was just curious about that. So I spent years immersed in it and then have carried on for the past, I guess it's been 18 years now, with specific tools of channeling a spirit guide, tuning into energies beyond the everyday thinking mind, but quite specifically to medical intuition, tuning into the body, tuning into what's going on with my stomach with this, complaint, or what's going on. Let's talk to the liver for a few minutes and see what's happening here, that kind of thing. So using muscle testing is another, some people would call it intuitive tool or energy type of tool. I know you talk about it through Spooky 2, which is great formally in your manual, and bring it up. And I can't say enough good things about it. That's my go-to often, because it's quick, is, okay, what do I do with this? Do I choose this or choose that? Do I do this now or do I do that now? Muscle testing is when you learn how to ask those yes/no answers, and whatever method you use, it works. And for anybody who doesn't know what muscle testing is, it's basically, I think it was developed around the 1970s by a chiropractor who found that when you brought a substance to the person's energy field, he was testing nutrients and supplements and foods. If the substance was harmful somehow, the person who would resist press down in their arm to have them resist. And if the substance was harmful, the body couldn't maintain strength. If the substance was good for them, the body could hold the position. And then they found out this happened with emotions. Negative emotions, loss of strength. Positive emotions, holding strength. So this has been applied by countless practitioners and everyday people out there all the time to use as a tool. There are various ways of doing it. There's lots of info out there. And I think it's fantastic. Again, a learned skill, right? Yet another learned skill. But I think, with training, with practice, there's lots of possibilities out there. People are, welcome anybody to inquire with me as to, different training things that I would recommend. But I think the concept is odd to people that are especially very science-based. Well, how can you, I don't need to tell you about this, you're involved Spooky 2, which is energetic medicine, right? It processes. But I think it can be hard to make that leap because people think it's not scientific. It's quite scientific. All energy is very, quantum physics is all very scientific. And I think if you can't get your head around that, for people watching, there are great things that you can read to just start to, that's what I had to do. I came from science, health, orthodox healthcare. How could this intuitive stuff be real? Really struggled with it. So I had to read books on science experiments to do with intention. Lynn McTaggart's book, The Field, was one of the first ones I read. Fantastic. All these experiments on mind, intention, and going back and changing things in time. I know you've done episodes around time and stuff too. So
that was an interesting one.
Pardon?
That was an interesting one, yeah.
Yeah. So I haven't listened yet, but I saw it. I definitely want to check that out. So you can learn this stuff yourself, the intuitive realm, and then you can also hire people to help you with that, help teach you, do, access. So I do both. I do it for myself and I help other people with it. And I highly recommend in some form that if you're curious at all, just check it out. Yeah.
This muscle testing, just as an aside,
Yeah.
it's very simple to learn. Well, there's different ways of doing it, and well, once you've experienced it, especially as if you're cynical about it, if you really don't think it's going to work, and then you try and oppose it, and you can't help it but give a feedback, and it's just incredible to actually experience that. And
yes.
Yeah.
They're
free to try. So.
Yeah, I think there's a theme emerging here. I think in some of what we're talking about, that if you can find that curiosity, that little bit of opening, that little bit of willingness to, well, I don't know about this, I haven't had experience with it, but what would it be like to just check it out?
Yes.
What would it be like to just be curious, and maybe you don't have to jump in with both feet, but just inquire a bit and find out. And I think that can serve us well in so many areas of life, including mental health.
Do you do any meditation, Lisa?
Yeah, I've done various kinds of visualization, meditation programs, CDs, audios, and so I tend to mix it up.
You're not supposed to mix it up, Lisa.
I tend to mix it up. Oh, there's another, debatable thing. People who do certain forms of meditation think that that's the best form, and I wouldn't argue with that if that's working for somebody. But I've done very focused programs for, a year at a time, an hour a day. I've done shorter ones of 10-minute visualization things. So I do tend to, based on what I feel I need that day, but I know if I don't do something like that, I notice a difference. I notice I don't come down to relax in the same way. So I think there are many ways to do it. And so you heard, you don't mix it up. That's what you've been.
Well, I'm just talking on what I've been told, that I've started doing transcendental meditation, and I know of a friend of ours who's very experienced in one form of meditation, start doing transcendental, and then they went back to the first one, and then they're having difficulty doing the transcendental again. So, but I guess it's really finding a form of meditation that suits somebody the best. And I personally have tried other types of meditation, but I wouldn't really try more than once, because it wasn't fun. It wasn't natural to always have my back perfectly flat and not think about anything and visual. Oh, it was just too difficult, really, for me. I like things simple, being a lazy person. So, and transcendental meditation, you basically just say a word to clear your mind of other thoughts and just relax. And if your mind wanders a little bit, well, let it wander. Your mind wants to do it. Well, why keep it tethered?
Yeah,
so
you can't stop your mind.
No, and I just couldn't. I'd find myself solving problems while I was doing meditation in the other one, and I couldn't stop myself. With this one, I can just relax and just enjoy it. And also another benefit is it's only 20 minutes.
Yeah. It's more doable than an hour, right?
Doable, that's the word.
Yeah. I think, you made a good point that people have to find what works for them, and you may have to try a bunch of different things. But the whole idea of coming to some refocusing of the mind, because you can't stop it from thinking, but as you're talking about having the phrase you say or the focal point you keep coming back to, and then your mind goes in between. But that art of practice of bringing the mind back to focus that's common to so many styles, I think, can be really helpful. Yeah.
Yes. Now, you mentioned about the value of looking inside yourself, exploring. Also, we were going to talk about exploring your purpose, values, beliefs, and self-connection. Can we talk about that a little bit?
Yeah. So I think I mentioned, just touched on briefly about kind of losing your sense of connection to your inner self with the daily pressures of, illness and that survival energy that gets triggered. And so one of the things I like to really emphasize for people is this whole idea of when you lose yourself in the sea of symptoms and illness and misery, feeling like you can't do the things that you want to do. It's kind of like, I see this as kind of an anchor point, like a self anchor point of, okay, well, what do you know for sure? And what, as Oprah says, know it for sure. And what can you hang on to? And what can you come back to deep within yourself as that part of yourself that it isn't destroyed by the illness, the part of yourself that hasn't gone anywhere, but you may have lost sight of. So focusing on your values and your core beliefs and who you are as a person, which of course does change a bit over time based on your experiences, but it's that deeper aspect of being versus doing. You lose the doing part when you're sick for a long time. And because I think all cultures seem to be, in general, there's differences of course, but the focus on doing is so overrated. And you remove that in illness and, well, who am I anymore without my role as I can't be a mom the way I want to, and I can't do my office job the way I want to, and I can't be a partner the way I want to, and all these areas. I can't do my garden the way I want to. I can't, take care of my dog the way I want, all these things that people feel like they can't do. So the looking at strengthening your values and getting in touch with, what they are. If, for example, for me, strong values for me are honesty and integrity and kindness. If I think about those values being really important to me, it also gives me an anchor to know where I'm out of sync with other people, with health professionals, with areas, of my life, with circles of people. And I think when you bump up against someone who doesn't share the same values at all, it can be a good reflection back to you to know, okay, the reason this was so upsetting to me, or the reason I just can't manage this particular health professional, I need to find somebody else, is they don't have values that match who I really am and what I strongly believe in. So getting in touch with that, I think going back to the decision making, it helps you make better decisions. And then going back to the, managing day to day, that awareness in day-to-day life and functional ability, it really can help you to pull these things together and make certain decisions about how you spend your very limited time and energy. The purpose part, people talk about life purpose, and I do an intuitive process called Soul's Blueprint, looking at, well, who are you now in this incarnation, and what brought you here, and what are you here to do, and how's that going so far? Is it being expressed in your life and your work, if you're working, or not expressed? And there are ways, formally, books, courses, all kinds of stuff for getting in touch with your life purpose. Again, that's an anchor point. When you lose that sense of self, of what matters to you, it can be really hard to sort of wonder what you're fighting for, or wonder what you're moving towards, or what you lose sight of what matters to you most in life and what you're here to do. So I think they can be really strong focal points for getting in touch with what you're doing here and where you're going, and ways, as I said, to navigate through this whole long process.
A couple of questions have come through on Facebook. Thank you for your questions. There's one from Teresa Bruin. Teresa asks, what do you think about ozone machines? Have you tried an ozone machine, Lisa?
I haven't. That's one thing I haven't tried. I've heard fantastic things about 10-pass ozone, particularly for Lyme. I heard good reports on it. Like everything, I've also heard the odd, oh, well, that didn't work for me, which is, it's tough, right? Because there isn't one answer for everybody. But yes, I've not personal experience, but I have heard some very positive things about that very strong process.
And a few summers ago, Teresa, I had an expert talking specifically on ozone, and he was a trained doctor. He would take the ozone intravenously, which is quite scary in my mind. But he, I believe that will have terrific results with Lyme because it'll take any spirochetes which are inside in the bloodstream, and it'll take the ozone directly to the organs. But he was saying how remarkable ozone is. And ozone machines aren't expensive, especially the ones that just ozonate water. So perhaps you can get a cheaper model and just see if there's any improvement in your condition. Okay. Another question is from Bob Tompkins. Hi, Bob. Bob asks, what should be done after completing... Oh, this is actually a spooky question. Sorry. Bob, can I answer this question after the SAMA? Because it's not really a question that's for the expert that we have here. So I'll answer this question after the SAMA. So sorry for that, Lisa. Now, how does the acknowledgement, truth, and presence be powerful healers?
Now, this is another favorite topic area of mine. I think also underrated and under-discussed and underappreciated in the world. And that's by acknowledgement. One way to acknowledge is by the power of compassionate listening. And it's being able to, this is I'm going to talk about applying to yourself as well as in applying to other people. And it's easier said than done. When you're sitting with someone who's very distressed, in person or on the phone, it can be really hard to not try to fix, try to judge, try to come up with suggestions, try to make it all better, try to joke the person out of it, try, lighten things up. But the power of someone being able to tell their story, to talk about their feelings, to express what's going on, and have someone not just kind of go, oh yeah, okay, sort of be there, but really be there, really feel their presence, feel their caring, feel that heart connection, and not get interrupted, not get, as I said, off on all kinds of side agendas. That being present it's something to look for, I believe, hard to find, but something to look for in health professionals, even if you can get a little bit of that. It's something to look for and hope for in loved ones, people close to you, friends, circles. I think the power of healing in that, just that act of being truly heard and seen and witnessed and felt by someone else is absolutely amazing and absolutely underdone. So as you can imagine, of course, it takes a lot to be able to offer that to somebody. That's a learned skill too. And it's not just professional training, it goes deeper than that. Some professional training can talk about listening skills and stuff, but to be, I think, a true listener, you have to work on yourself. And this is something that is a bit of a hot topic for me in health professionals. I would love maybe in future worlds or as I recover, I would love to work with willing health professionals on this, because I think it could change the face of healthcare, that in itself. Being able to have them, by doing their own work, and I'll talk a bit more about what this means, doing their own work, they're able to really be present for somebody else. Because, we've all had those experiences, not just from healthcare professionals, but well-meaning people around us. And, when you have a chronic illness or serious illness, or often, a decline, like somebody is declining in a condition for which maybe there isn't treatment and they know that their end is coming near. This is really uncomfortable for people who haven't dealt with this at all in themselves or around other people. It's really uncomfortable. Whether people acknowledge it or not, they don't really want to often be there and deal with it. So people can act pretty weird around those who are suffering with whatever it is they're suffering with. They can sometimes, and it's triggering their own vulnerability. It's triggering their own discomfort and their own oh my God, I can't imagine being in your shoes. But instead of being aware, back to self-awareness again, instead of being aware of where that's coming from and their own discomfort, and maybe even honestly saying, oh, I'm so uncomfortable, I'm so sorry that you're going through this, it's must be really difficult, and I don't know what to say, I don't know what to do, show me what is helpful. Even that heartfelt response would be better than, oh, go on, pull up your socks, or some of the things that people say that are judgmental or harsh, or, oh, well, you're not really sick, you can't really be sick, or blaming them, well, if you just did this, then you'd be all better. Like, there's so many horrible things I hear from people all the time about how they're being treated by friends, family, often awful, and health professionals that are they're just cruel. But if we, and yes, I would like to see health professionals be more responsible in this, but if we step back, be that observer and look at, well, why is this happening? They're triggered, they're scared, they're vulnerable, or they're involved in their own busyness of their life, and the thought of really taking in that suffering of someone else is too much. And so, I think that's why people can't really be there often. But there are, just like I said, learned skills. There are ways to train for this. There are ways that you can ask for caregivers, family members, health professionals, you can just outright ask the person, what would be supportive to you? Yeah. How can I be there for you? What do you need? And be open and open your heart. I was kind of famous as an OT, not famous out there, but known as an OT because I just always wore my heart on my sleeve. I would sit and cry with my quadriplegic patients over their fate. And that was considered unprofessional, right? Well, you're supposed to be stiff and set back. There isn't a kinder thing I think that a health professional can do than to have that degree of compassion. Not that they're sobbing and can't do their job, but you know what I mean? Just that moment of human connection where they, through your empathy, through your heart, through your expression, you're saying, I see you, I hear you, I'm witnessing you, I'm here. That is incredible healing. It's amazing.
I don't think I've ever seen that in a medical doctor.
Yeah.
Have you ever seen that empathy? I've seen care.
Yeah.
And professionalism, but I haven't seen the empathy and the feeling. Now, I read your book, and at the end of the book, which was very detailed, I had still one question which that book didn't answer, and I'd like to ask that question.
Sure.
Now, it is a bit close, but your book did cover personal things, which surprised me how open you were, which to me showed me just how, to what lengths you'll take to teach people, to make people. And so that I really did gain a lot from it. But this is the question which I had. You've had a chronic disease for 30 years plus. In your opinion, do you think this disease has made you a better person, better than what you would have been if you had not been struck with Lyme?
That is an excellent question, and I think all of us need to ask ourselves that. So I appreciate you asking me, and I haven't thought about it lately. But my answer is yes. And the reason for that is that, yes, I was always empathetic. Yes, I was always curious. Yes, I've always cared about people and, enjoyed doing a lot of learning about a lot of things. But the amount that I've learned, because I've been desperate to figure things out, is just tremendous. I would never have the degree of learning and the breadth of variety of careers and things like that has just completely opened me to so many things. If I had stayed healthy as an occupational therapist, as much as I was the weird one doing weird energy things even then, but I think yes, I would have branched out a bit more. Maybe I would have gone into the intuitive and energy realm a bit more. But I think I always would have been stuck in that science only conventional medicine paradigm in order to just get by in my environment. So just the learning part, and answer to your question, yes, I've learned so much more in terms of person, like the inside part. I mean, absolutely. I've and one of the positive things I think that's come out of this for me is the ways in which I've had to, for my own survival and my own recovery, I've had to look at things within myself that I would not have taken the time or gone through that hard work, I think, of doing it. Because, when you're sick and you're alone a lot, there's nobody, like, it comes down to you. I mean, it does in life anyway, but it's really glaring. It's in your face when you're sick for so long that there aren't all these external distractions. You're not going out drinking with your friends if that was your thing. You're not, involved in sports. You're not involved in as many, cognitive or career pursuits and social things. So it can get very quiet, but in that quiet, you can really, it gives you that opportunity to go deeper. And then also when you find all these external things aren't the ticket out, the ticket back to better health, it just naturally, if you're a curious person, which I am, you start to go deeper and deeper and deeper. It questions if you have faith in the universe, God, something, whatever, beyond your everyday thinking mind energetically. That's an opportunity to strengthen that. For me, it has. I don't have a formal religion, but I do have a stronger connection to what's out there. I have a much broader capacity for my suffering and other people's suffering. I'm kinder to myself than I was. So, yeah, in so many ways, I think it has made me a better person, which I would not say on my bad days. I would not.
Well, we're all human, but what you're doing is terrific. Hey, I've got another question for you. Can you explain how perseverance and consistent small steps with the right support are important and is actually essential for recovering from bad health?
Yeah. Speaking of perseverance, there's a quote that I love. I'll just read it. When you've exhausted all possibilities, remember this: you haven't. That's Thomas Edison. I love that because people are saying, "Oh, I've tried everything. There's nothing left. I'm going to be sick the rest of my life." Perseverance, because it may be, and you hear this in business, you hear this in personal lives, and finding a partner, you hear this in health, trying to get better from a health issue. Just when the person was just about to give up, they almost did countless times, but maybe that one last time, oh, there is another piece.
Yes.
The tipping point, it's taking them beyond. So, and, it depends how you're wired too, but for me, I'm wired to persevere. I've been like that my whole life. It's an advantage and disadvantage in type A people. But the advantage of that perseverance that I don't see in people who somehow can't find that in themselves, who don't have the supports, whatever. If you don't persevere, you're not going to get beyond where you are now. It's happenstance, external influences. So perseverance, absolutely, just keep going. You got to keep going.
Yes.
The small steps, for sure, and the perseverance is in the small steps. And we think, oh well, this one minute thing isn't enough to do anything. We're conditioned to be kind of all or nothing, and go for the big times. But it's those consistent small steps. Someone's trying to get back to some exercise, literally walking around the house, then walking around the yard. And then, I did this, I made it, speaking of yearly improvements, I used to go to the gym and work out in my better years, missed it, love it. I started back a year ago going for 5 minutes, 5-pound biceps curls a few times, a couple of main muscle groups, go home, go to bed for 2 hours. But I kept it up once a week and twice a week, little steps. And now, the strength is coming back, but it doesn't happen overnight. It's like bit by bit by bit. Very frustrating and necessary. But and then the supports part of that. You know, we're wired as human beings to be in community, to be in connection with people. We're not wired in our survival brain, in our physiology. We're not wired to be complete loners all of the time by any means. So the listening part I talked about, the connecting part, the supports, the going within yourself, the building of self-awareness to really identify your needs and be able to ask people and connect with people and find like-minded people and reach out to a community of people who, you know, are kind and understanding. I think all of those things really have to be in place as part of the recovery process.
We're talking with Lisa Dennys. Thank you so much for coming onto our show. We are blessed with your presence, and we've learned a terrific lot about Lyme disease and how to beat it, or how to fight it and improve our lives. We've had Lyme people in the past on board to teach us, but you've looked at things from a different angle, more of a personal angle. And really, there is hope and there is a light at the end of the tunnel. So thank you so much for our show.
Thank you.
For our show. Now, the book is titled Unveiling Lyme Disease. Where can people purchase this book, Lisa?
It's available on Amazon worldwide, so that's an easy way to get it.
Great.
Kindle or paperback format. Yeah.
I've read the book. I found it very, very, very good reading. So well done.
Thanks, John.
Okay, and I've got one. Well, I'll answer the last unanswered question just now. It wasn't one specifically for you, Lisa, but I'll answer that now. Is Bob Tompkins, who asked what should be done after completing Spooky 2 Lyme protocol to maintain the progress made. Well, Spooky has got a Lyme protocol which has been proven to be very good, but after it's been completed, you can repeat it several times, but you can certainly run the terrain protocol both in the background whilst it's running and between sessions. Lisa, the Spooky 2 has, we've got a terrain protocol, which is the first thing you basically do when you take Spooky out from the box. And what that does, it takes all the heavy metals out and all the nasties. It starts with the heavy metals, goes through the parasites and then to the bacteria and then the viruses. It goes all the way through and gives you a good flush, your whole system. And so, Bob, this is what I'd recommend you do to maintain gains. As Lisa has explained, you get your ups, we see a little bit of a light and then it goes down again. Well, with any luck, if you run the terrain protocol, that little gap will become larger and give you more of a fighting chance with this dreadful disease. Okay, well, thanks again, Lisa, for coming on to our show. It has been fantastic. And thank you, everybody, for watching. And have a good week until the next time. Goodbye.